Chief Harms here with Chief Jenkins filling in for Deputy Chief Adam Mitchell today. This is our first update of 2022. And as you all know, 2022 has not failed to live up to maybe 2020 and 21 as we have headed into this one here.
So starting this morning, and it changes daily, Chief Law updated us, we have 95 members off, and that's the whole department, with 72 COVID positives. And to kind of share, Sac City did not report. Consumnes said they had about 13 off positive and Folsom 12 positive. So COVID's making a pretty good run.
Making a good run. I had the opportunity to speak with the fire chief in the city. Their numbers are very, very close to our numbers also. The last ones that he was able to give me on those there. You know, talking to folks, it's anywhere between the 14th or the 15th of this month or towards the end of the month that we see possibly a peak that is happening. The things that I have seen is that it seems to be the severity of the illness is less, but it does seem to be spreading very easily, and we see those out there. And I think it's important that we reinforce that with the spreading that's going on, the importance of disinfecting the station, cleaning the station, apparatus, equipment.
Correct. We have two things that Decon 1, Decon 2, kind of where we're calling is the deep cleaning at the fire station level and even at your workplace here at the administration. So the basic daily cleaning, wiping down, deep cleaning, spraying, and all that is there. And then we actually have the foggers too that can be activated. Each battalion has one in their cache, usually at the battalion chief's office. And we do have parameters at the district level where we have 3 members on shift, same time, that will pull a trigger, coordinating with EMS Chief Law, Operations, Chief Mitchell, and the shift commander, where we will say, hey, we need to get that station decon. But that is, if the troops out in the field feel they need it, just go through your chain of command. We can have that discussion. It is there to fog as extra. But remember, the deep cleaning daily is the one that's probably going to cause the most effect to get those challenges of disinfection.
I think that's a good side of it there. It is Wednesday, we had an update from County Health that came down from the state as far as testing. That information will be out there. One of the differences talks about testing and contract tracing on that. What we have some options, but I think one of the key things is with us managing our own testing site, is that anybody that wants to be tested can get tested, and we would encourage people. One of the statements from Dr. Garzone was some of the new guidance actually probably could increase the amount of spread of not testing people. Again, all the way through this, we have passed, or we have, I shouldn't say passed, we have followed the guidelines from the county, and we will continue to do those as we move forward. But we encourage everybody with an exposure or that you think that you've been exposed is to be tested, and that we can move forward from there. When we look at staffing, I know staffing has been some challenges as we've gone along there. Currently in our system, we are down 22 engineers as of today, and we are positive 25 firefighters. One of the things that we've been working with labor on is the moving up of the engineers exam. The new dates have been posted. We know that those engineers positions has definitely taken a toll on the engineers that are out there. We'll move up that test. We'll also still on track to have the Fire Academy that will start in February. Any other updates from staffing on your side?
I think when you mentioned 25 positive firefighters, actually today I believe were 7 firefighters that we had to fill those vacancies, and I believe 2 engineer spots. So to kind of give a little bit of, even though we're negative 22 engineers, there are days that 7 or 8 engineers we have to fill. Today, for an example, we're kind of down on firefighters, so it's a moving target as far as staffing. The other part I would say when we get into the testing is we've had, after the fact, so members have said that they were symptomatic, they kind of realized a sore throat, runny nose, 2 to 3 days prior to when they finally said, hey, I think I need to go get tested. And that's caused a lot of work with the contact tracing, the backfill, and then exposure to other people. So if you have any symptoms, stay home and let's get you tested and make sure you're not COVID positive earlier than later.
The other side of it is that the professional staff is working remote. And then in the middle of everything, who would have expected that telestaff was going to go down at the exact same time too? The biggest update that we have heard is that our data is retrievable, and they're looking at the end of the month for, I would say, access to it. I'm cautiously optimistic on when that will be in place and being able to move forward. And again, through this whole thing, each time that we've had these issues, the membership has risen up and has been able to move forward with that. So again, we'll continue with that. Another big issue that has been going on is wall times. Over the past period of time, me personally have been working with the hospital CEOs, our own SCIMSA, our own chief officers. Last Friday, though, it was at an impact that we dispatched command officers to each hospital. We have gotten what I would say are hospital-grade gurneys or cots from the county, and we are pushing very, very hard on the hospitals as far as the wall times, consolidation of patients, the opportunity to bring in paramedics from outside to manage wall time, and then to set up triage areas at hospitals. So far, what I will say is the action that has been taken by the fire service is the only thing that has followed through. We've had a lot of promises either by the hospitals or by paramedics being deployed or other people that are there. Once again, we're the only ones that have been able to I would say, have an impact on our own problem.
I'd say Metro's taken the lead. And I know Chief Harms, when I was on duty, contacted myself that we needed to get cots and get them to the hospitals. Some of the other agencies don't have the avenues or the mechanisms that Metro Fire has, but by getting those cots, we have 10 cots at MSJ, 10 at UCD, Kaiser South, and Mercy San Juan all have 10 cots that have been utilized to offload patients. We've had engine companies, I think they rotated yesterday, 3 different engine companies that actually went to the hospital so the medics could offload to them and help with the system. This morning, Chief Law had contacted the state is working on getting paramedics from the federal level to help out at the hospitals to assist with that offloading, but it is ongoing. If I could add, though, the wall time. We've had a few medics that are staying transport arrived and leaving the hospital to go back to their first in. And what that is giving a false piece of wall time. So we want to capture the correct data and time, and we need medics to clear from the call. If you need to go out of service for staffing changes or restocking, things like that, just use your chain of command and go through the process and get yourself out of service. But remember to clear from the call. We have had chief officers heading down to the hospitals to talk about getting you off the wall, and the guys aren't there. So we want to make sure that we are capturing true data, because the fire chief, I know he's having conversations with the CEOs at the hospitals for them to fix the problem. And when we've looked, I know one time last week we had one medic that actually did go back, and I got to make sure that we're sending accurate data. So making sure we're doing that in the field will help.
So me personally, I'm calling the CEOs and asking them to walk downstairs and meet with you. I don't think that they are, but we're asking for that portion of it. So more to upcome, or more updates will come on the wall time. We talked about the engineer's exam. We talked about the fire academy as a go. Probably the last 2 things that I have, one is that the donated leave program which was the catastrophic leave program, is out there and is available. I am a huge supporter of the program. It is amazing the support that it has done for members all the way across the district. I just filled out my paperwork, and I encourage you to fill out your paperwork also for the donated leave program. It's just a great opportunity for us to help other members that are having struggles, especially during this difficult time. And then just the last thing is just, here locally at Metro, just the amount of fire activity and the call volume, and how proud I am of each and every member out there for our ability to continue to provide service and doing it at the highest level. I know that we had a combination fire. It happened to be in the city, but just a ton of our units on it, able to make rescues out of that residential. And then you all have seen it in either Philadelphia or New York. It's just these high incidents of high loss of life. And each and every day what we go back to is the training that is provided and the guidance that we have, and then what you all do in making very sound decisions every single day out there in the street.
think it's good stuff, and I know with the BC group that I dealt with a lot, when we have to close down companies, they are not liking that, and they're working to try to keep stuff staffed and members, and the membership calling in to assist, how can I help and come back to work to keep stuff staffed for the public. But I do reiterate the fires and the calls that we're going on. Luckily, in our agency, the fire fatalities are low, but when we look at a lot of these different agencies, Philadelphia, New York, Sac City just had some the other day, is keep doing what we do, keep stuff staffed, keep our training going, and maintain the professionalism to help the people out there. It really does make a difference. So thank you.
Finally, just thank you for everybody that's been reaching out. If you have questions, put it through the chain of command. If you have a question for me or a question about anything that Charlie and I talked about, reach out to us, and we'd be happy to go into more detail. Have a safe shift.
Take care.